Everyone wants white teeth, but almost no one asks the most honest question: what am I risking to achieve them? Because whitening doesn't start with color. It starts with a choice. For years, I thought whitening was harmless, a cosmetic upgrade, something you could experiment with. The internet is full of promises. Whiten your teeth in one day. Just 2 ingredients make your teeth white. Dentist-level results at home. But what they don't show you is what happens after. Here's something most people don't consider. Your enamel is not invincible. It doesn't regenerate. Once enamel is altered, those changes are permanent. A lot of DIY whitening methods, especially aggressive ones involving abrasive powders or frequent scrubbing, don't just remove stains. They slowly thin the enamel. Here's the truth no trend will tell you. There is no such thing as a safe shortcut for teeth whitening. Your enamel doesn't regenerate. It doesn't heal. It doesn't grow back. Once enamel becomes thinner, the effects are long-lasting. And yet, people jump straight into whitening without asking the most important question: am I even a candidate? Because not every smile should be whitened. Some teeth are already under stress. Some gums may already be irritated. Some enamel is already compromised, even if you can't see it yet. Whitening in those cases doesn't improve anything. It speeds up long-term wear. This is why professionals matter. A dentist doesn't see yellow or white. They see structure. They see risk. They identify risks before they become issues. And this is where another myth collapses. Faster is not better. At first, everything looks fine. Your teeth may even look whiter, but then something changes. Cold drinks may begin to cause noticeable discomfort. Hot coffee can start to feel unpleasant rather than comforting. Your teeth begin reacting to things that never bothered you before. That's not whitening. That's long-term enamel wear. One of the biggest myths is that baking soda or similar substances are gentle if used carefully. In reality, repeated mechanical abrasion, even mild, can wear enamel down over time, especially when people chase fast results and use it too often. Another problematic myth is that sensitivity is normal and will go away. Sensitivity is a warning sign. It's your teeth telling you that the protective layer is being compromised. When this protective barrier is weakened, the balance of the oral environment can be disrupted, affecting both the teeth and the gums. This is where professionals make a critical difference. Dentists don't just whiten teeth. They evaluate enamel thickness. They check gum health. They choose methods and concentrations based on your specific mouth, not a generic formula from the internet. Professional whitening is controlled, monitored, and designed to protect enamel, not sacrifice it for speed. Yes, it takes longer. Yes, it's more cautious, but it's built around one principle most hacks ignore: do no harm. A healthy smile is not the whitest smile possible. It's the one that doesn't hurt, the one that doesn't flinch when you drink water, the one that will still be strong years from now. I clarify that true oral care is about patience, prevention, and professional guidance, not shortcuts. If you're thinking about whitening your teeth, the smartest move isn't asking, how fast can I do this? But, how can I do this safely? Because a brighter smile isn't worth it if it costs you your enamel. And trust me, your future self will thank you for choosing long-term health over quick results. When people think about teeth whitening, they usually imagine one simple procedure. In reality, dentistry offers several professional whitening methods, and each one works in a different way. Once you understand how they work, it becomes clear why whitening should never be random or experimental. Let's break it down. How professional teeth whitening actually works. Professional whitening is not about scrubbing teeth or removing enamel. Dentists don't polish away stains. Instead, whitening works through a controlled chemical reaction inside the tooth. The key materials used in dentistry are hydrogen peroxide, carbamide peroxide. These materials release active oxygen. That oxygen penetrates the enamel and dentin and breaks apart stain molecules trapped inside the tooth structure. The difference between methods isn't the chemistry, it's how the material is applied, how strong it is, and how carefully it's controlled. In-office professional whitening. This is the fastest whitening method available in dentistry. It's done entirely in a dental office under professional supervision. The gums are carefully protected with special barriers, and a high-concentration whitening gel is applied to the teeth. In some systems, the dentist may use LED light heater, a combination of both. These don't whiten teeth on their own. They speed up the chemical reaction. What this method requires: healthy enamel, minimal existing sensitivity, professional isolation of gums, careful timing and monitoring. Why people choose it: immediate visible results. One appointment, controlled environment. What to consider: higher risk of temporary sensitivity, not ideal for everyone. Custom take-home whitening trays, dentist supervised. This is one of the most popular and safest professional options. A dentist takes impressions or digital scans of your teeth and creates custom-fitted trays. These trays fit precisely, like clear aligners. You're given a professionally prescribed whitening gel with a specific peroxide concentration and instructions. What this method requires: custom trays made by a dental professional, professional-grade whitening gel, consistent controlled use. Why people choose it: excellent results over time, lower sensitivity risk, full control over pace, can be paused if sensitivity appears. This method prioritizes long-term enamel protection. Dentist-approved whitening gels or strips. Some over-the-counter whitening products are designed to align with professional standards and may be recommended by dental providers. They contain lower concentrations of peroxide and work more gradually. What this method requires: strict adherence to instructions, awareness of gum contact, realistic expectations. Why people choose it: gradual whitening, less aggressive, more accessible. Professional guidance is still important to avoid misuse. Internal whitening, for darkened, non-vital teeth. This is a specialized dental procedure used when a tooth darkens from the inside, often after trauma or root canal treatment. The whitening agent is placed inside the tooth, not on the surface. What this method requires: a non-vital tooth, dental supervision, multiple controlled sessions. This method targets discoloration that surface whitening cannot fix. Combination whitening. Some patients use a combination approach: in-office whitening for an initial color boost, followed by custom trays for maintenance. This balances speed with safety and longevity. What professional whitening is not: scraping or grinding enamel, random product mixing, ignoring sensitivity, chasing instant results. If unusual discomfort or irritation occurs, it's a sign that the process should be reassessed. The real takeaway: the best whitening method is not the fastest one. It's the one designed for your enamel, your gums, and your history. That's why whitening always starts with a dental evaluation. Teeth can be whitened, so if you're thinking about whitening, don't ask, "How fast can I do this?" Ask, "How do I protect what I can never replace?" Because trends fade, filters disappear, but enamel remembers. And once it's gone, no amount of white can bring it back.